Welcome to Cosmetic Surgery and Coffee, my very first vlog, and this is episode number 1, How to Become a Plastic Surgeon. And I'm Dr. Manish Shah. I'm a board certified plastic surgeon here in Denver, and this is my lovely muse, Misty Mills.
Hi.
Hey guys. So this is our very first foray into vlogging, and so I want to make sure that we can provide you guys out there some great information about various topics in plastic surgery and other realms in general health. So today we're going to be talking about how to become a plastic surgeon, because a lot of people ask that question, and I think there's a lot of people out there both in the lay press and aspiring plastic surgeons to be that might want to find out some really insider's information on how I became a plastic surgeon and how they can apply that to their lives. But this is called Cosmetic Surgery and Coffee, and so today we have our coffee.
Cheers.
Cheers. So what are you drinking?
I'm drinking a 2-pump skinny vanilla latte.
Oh, you're so tiny. You don't need skinny. I'm drinking a caramel macchiato. Now, it's not
That's a good one.
It is a good one. It is a good one. So, interestingly enough, the first segment of the show is called Did You Know? So, did you know about coffee? Coffee is actually an amazing drink, and it has got a lot of health benefits. So, I found an article from healthline.com, and in that article, they talk about 11 concepts about coffee and caffeine that are all proven by science. And so I'm going to talk to you about some of these, and you may know some of them, the obvious ones, but you may not know about other ones. And then from there we'll move on, and Missy will ask me about details about my life and how I got to be a plastic surgeon. And we finish off a little segment called Real Self Question of the Day, and I'll segue to that when the time comes. So, something you need to know about coffee. Of course, the most common thing that you need to know about coffee is that it can improve your energy levels and make you smarter. Duh. I mean, everybody knows that. That's why we drink coffee in the morning to wake up. But the mechanism is actually quite interesting. There's a neurotransmitter in the brain called adenosine, and it tends to regulate neuronal or nerve cell activity. Now, caffeine blocks adenosine, and so when you block adenosine, you actually get upregulation of a couple of neurotransmitters. One is known as norepinephrine, and the other one's known as dopamine. Now, when these are upregulated, you actually increase the speed of your nerve cell firing. So, of course, if your nerve cells are firing faster, you're going to be more effective. Your brain is going to lock in a little bit quicker. You're going to have more awakeness and alertness, and your mental function is going to go up. So, that's one great little thing about coffee, but I'm sure you probably know that. You're probably drinking your coffee right now on this Sunday morning. So another thing that I found out is that coffee helps you burn fat. So, and there's a couple of things that you need to know about this. Caffeine can boost your metabolic rate between 3 and 11%. Now, that's pretty good. I mean, every time you drink a cup of coffee, you're burning fat. And so what ends up happening is caffeine use throughout the day can kind of keep you at a fat burning stimulation level. So for those of us that need to lose a little weight, it helps out. Now, the fat burning rate goes up by up to 10% in people who are heavier and up to 29% in lean individuals. So that's pretty cool. So another point is caffeine can actually drastically improve your overall physical performance. Now, it stimulates your nervous system, and it increases, your body's chemical reaction signaling to break down body fat that's been stored into something called free fatty acids. Now, free fatty acids are a quick, burnable source of energy, great for working out. Because caffeine increases your adrenaline or epinephrine levels, that increases your fight or flight system. Now, what that means is that it's been able to show up to an 11 to 12% increase in overall physical performance. So you may want to consider a nice cup of coffee, strong, plain coffee, not with any really additional frills, about 1 hour before the gym, and you could burn through your normal workout with far more vigor, far more energy. Now, a little aside is you can actually add something that's considered a medium chain triglyceride or an MCT oil like coconut oil to that coffee, something that you find in that company Bulletproof Coffee's coconut oil.
They add butter.
Is that what it is? EFA butter?
I think they add butter.
Okay. Well,
but coconut oil is good too.
Right. So if you're going to add butter, you need butter that has high essential fatty acids in it, and that would be grass-fed butters. There's very specific butters that have a really high level of EFA in them, and EFAs are very fast-burning fat sources. So again, you are able to have immediate energy to burst through your workouts, push harder, run faster, lift more, get even more vasodilation in your skeletal muscles and get a bigger pump. So something to consider 1 hour before working out is a mix of coffee and either EFA butter or coconut oil and move through. Coffee actually has very significant nutrient value to it. So they have vitamin B2, which is riboflavin. They've got B5, manganese, potassium, magnesium, and niacin. Now these vitamins are all important in both neurologic function and vascular tissues. So you get vascular expansion with niacin. You get neurologic support with the B vitamin. So it's good for both those things. Excuse me.
I have a quick question.
Yeah.
So niacin or niacinamide is really good for your skin. If you're ingesting it, is it equally as good, or does it have some sort of benefit for your skin?
Yeah,
also?
not to the extent that topical niacinamides do. So you definitely want a topical vitamin B5 niacinamide in your anti-aging regimen. So,
okay.
But the niacin in the body does more for cardiovascular function and blood pressure lowering and helping the health of your blood vessels.
Okay.
So interestingly enough, coffee may lower your risk of type 2 diabetes between 23 and 67%. Now the mechanism for this is probably those that drink a lot of coffee probably don't have a lot of excess peripheral fat. And most of type 2 diabetes comes from people who are obese. They get what they call peripheral insulin insensitivity. So if you are losing fat at a high rate, you're drinking enough coffee, you don't have as much of that peripheral fat and you don't have as much insulin insensitivity, and your insulin systems and carbohydrate metabolism systems work pretty well and normally. This is one that hits close to my heart. It's coffee may protect you from Alzheimer's disease and dementia. Now my mother is 72 and she is in late stage dementia. She was a healthy geriatrician physician up until about 6 years ago, and then she's had a rapid decline since there. So what she has, I worry about the genetics about it. So for me, I want to make sure I'm taking care of myself because I've got 3 teenagers to raise and I need to make sure that they can get through before, if it's my time for lights out, they're well taken care of. So it's up to a 65% lower risk in people who drink coffee on the regular. So consider that. Another thing, Alzheimer's is considered the #1 neurodegenerative disease in the United States. The second most common neurodegenerative disease is something called Parkinson's syndrome. Now, Parkinson's syndrome comes because of the death of dopamine generating cells in the brain, and it is a neuromuscular problem. If you've ever seen it, they have shakes and mobility problems, and eventually it does lead to an early death. Now, people who drink coffee have a 32 to 60% lower risk of developing Parkinson's disease, and it appears that it's the caffeine that's the reason for this protection, because they don't find the same in decaf drinkers. So if you drink decaf, you're not getting protection against Parkinson's. So you want to drink the caffeinated stuff, the stuff that's got electricity in. Number 8, coffee appears to have protective effects on the liver. Now, we're all adults, we get out there and we have a little bit of fun every now and then, and our liver takes a hit. It happens to be the recycling and trash compacting center of the body, in addition to the spleen. So it has to see drugs, alcohol, medications, whatever, fatty diets, and it has to process all that. And over time, it starts to take a hit. So there is a disease there's a disease process known as cirrhosis, or scarring of the liver. Now, it can be caused by a number of things: excess fat in your diet, alcoholism, and hepatitis. Those are 3 common reasons for it. So drinking 4 more cups of coffee per day reduces the risk of cirrhosis of the liver by 80%. Now, everything that I've been talking about today is covered in the literature, and you will find in the description below for the video, there'll be a link to the healthline.com article, and you can read about all this yourself. I like this one. Coffee can fight depression and make you happier. There was a Harvard study that showed women who drank 4 or more cups of coffee had a 20% lower risk of depression. And then there was another study of over 200,000 individuals that showed those who drank 4 or more cups of coffee were 53% less likely to commit suicide. Now, I want to go back to my very first point that talked about the upregulation of norepinephrine. Well, norepinephrine it's a drug, it's a neurotransmitter involved in neurologic function, and those people with depression tend to have depressed levels of norepinephrine. So typical drugs that you know about, like Paxil, Prozac, Zoloft, Celexa, they're all drugs in a class known as selective serotonin reuptake inhibitors. Now, serotonin is another neurotransmitter that when it's functioning in the brain, it pulls norepinephrine out of circulation and stores it in the nerve terminal ends. Now, caffeine upregulates your norepinephrine, which means it does the same thing in many ways as an SSRI drug, like a Paxil or a Prozac. And so coffee can help your antidepressants function better, probably because of this, though don't quote me on that. Just drink your coffee. Another thing, coffee drinkers have a lower risk of some types of cancers. So liver cancer is the number 3 cause of death from cancer, and coffee drinkers have a 40% lower risk of getting liver cancer. Colorectal cancer, which is the number 4 cause of cancer death, shows a 15% lower risk of colorectal cancer. So, something to consider. Number 11, coffee itself does not cause heart disease, and that is something that people have worried about in the past. And it has actually been able to show that it may cause a lower risk of stroke over time. Now, coffee and caffeine obviously slightly can increase your blood pressure, but what that effect tends to smooth out over time. Now, some people who have sustained high blood pressure issues may want to be careful with the amount of coffee that they take in because they've got to balance that off. But there's one study showed up to a 20% lower risk of stroke. Now, one thing to finish this part off is to say that if you smoke cigarettes with your coffee, you're probably negating most of the effects of the coffee itself, so stop smoking. Okay, soapbox over. So, anyways, thank you for listening to that part.
Question.
Yes.
So where is the threshold for when is it too much coffee?
I mean, I think the fact of the matter is, a lot of people with time, they become habituated to the coffee levels that they're taking in. And so I think 2 to 4 cups of coffee a day probably are realistic. Mm-hmm. I just feel like if you're having troubles falling asleep at night, or you're getting very, very agitated, or you're making multiple runs to the bathroom in the middle of your busy business day, you have to factor some of those lifestyle issues into it. But other than that, I mean, there's nothing bad in coffee unless you've got certain issues like hyperirritability, or if you've got something called PVCs, which are premature ventricular contractions, like little skips in your heartbeat. So if you've got some cardiac disorders, some rhythm disorders or electrical disorders of the heart, maybe coffee is not your best friend. You might want to try something like a good green tea, because there's plenty of great health benefits in green tea. But since this is cosmetic surgery and coffee, I thought we'd talk about coffee and its benefits today. So
sounds good.
Yeah.
Sounds good. Well, I'm kind of dying to know how you ended up becoming a surgeon. What was your road to making that choice? What was the schooling like? How did you end up where you are right now?
Well, I will tell you, it was a very, very long road. In fact, I graduated high school when I was 17, and I did not start my first practice until I was 34 years old. So it was a 17-year-long process. But when I was a kid, my parents are both retired physicians. My father was a very busy solo orthopedic surgeon in the Washington, D.C. area, and my mother was a geriatrician. Now, geriatricians take care of the elderly. And so she was the medical director of a very large nursing home community in the Washington, D.C. area. So I had medicine in the blood, and it was what I was planning to do my whole life. So I went through I went through high school. I did very well in high school, and doctors tend to do very well. It's just kind of how you get there. Medicine is a very difficult business. It requires a tremendous amount of studying, a lot of dedication, and a lot of hours put in. And you have to sacrifice a lot. That's the first thing. So now, I was a very, very busy high school student. I was in multiple sports. I was an Eagle Scout, and I had a greater than a 4.0 GPA. So I was a good student, and I did very, very well. So I went on to get an undergraduate degree at the University of Pennsylvania in Philadelphia. Now, my father's an orthopedic surgeon, and I always thought I was going to become an orthopedic surgeon. Obviously, I didn't. I'm a plastic surgeon. But there was a time in my life where I was not quite sure I was actually going to be a doctor. So I made a decision in college that I have a backup plan, and that backup plan was to do something in the medical field but not be a doctor, and that was to become a biomedical engineer. So biomedical engineers create devices that you see in medical facilities, doctors' offices, ORs all over the planet. Artificial hearts, ventilator systems, diagnostic tools and testing. They do all that stuff. That's who designs it. And I thought it was a really cool field to be in because I could do almost anything with that degree. And my program was probably the second best in the United States at the time for undergrad. So I was at University of Pennsylvania in Philadelphia. Great place to go to school. I had a blast in college. Hardest part was the every 5 day a week, 8 o'clock in the morning seminars and labs. But that's a sacrifice you make. I got through college, and I did end up deciding to go to medical school. So I moved to Charlottesville, Virginia, and I went to the University of Virginia, a very, very prominent medical school on the mid part of the United States on the East Coast. Beautiful little college town, very well known in academia. And at that point, I was still going to be a orthopedic surgeon. So, I went through my first year of medical school, lots of book learning, lots of time in class, hours and hours of lectures, like brain-numbing lectures. I have a picture learning system. I like to learn graphically. Not everybody likes that. I'm not very good with you telling me something or me spending hours reading. So, I took lots and lots of notes, but I loved graphic lectures and visual lectures, and that made it easy for me to learn a lot of information because I could remember even the pictures of slides that got put up, and I could remember them when I was testing, and I got good grades. When I got into so I went through my first and second year. Those are what we call the preclinical years. It's basically classroom time. Then the third year is when you start getting into your clerkships. So you go in and you do your actual being a doctor. You're wearing your little white coat and you're trailing around with all the senior residents and with the attendings, and you would go through medicine and pediatrics and surgery rotations, and you would do electives. And my one elective that I took was orthopedic surgery. I figured if I was going to be an orthopedic surgeon and take over my dad's successful practice in the Washington, D.C. area, I better get into this. And I have to tell you, it sucked. I had the worst rotation. In fact, I think my chief resident just must have hated life because he made it miserable for everybody down below him. So it turned me off on orthopedic surgery because I looked at my dad, and I love my dad, and I looked at him and I saw this guy who was gentle and sweet and just a workhorse in the operating room. I'm thinking, is that going to be what I'm seeing today in this rotation in orthopedic surgery? Is this what my life's going to be? I'm like, no way, I'm not doing this. And I did another rotation because I thought, plastic surgery sounds kind of neat. And I had a plastic surgery rotation, and at that moment in time, I spent time with a lovely surgeon. His name was his name is Dr. Kant Lin, and he was a craniofacial surgeon. And craniofacial surgeons, they help children. They help children born with craniofacial abnormalities like cleft lips, craniosynostosis, which is early fusion of the little sutures in the skull so that they have weird head shapes, and cleft palate, and ear abnormalities like macrotia or anotia where they don't even develop an ear. So I got to see this beautiful work that he would do on these little tiny structures. And when I was growing up, I loved to tinker. Like, I would take things apart in the house, fix them, and put them back together. It was very intuitive for me to work with my hands. People say I've got piano fingers. They're not very long, but they're very fine and dexterous. And so I was always very good with my hands, and that's something that appealed to me. So I thought, geez, I've prepared for my whole life to be an orthopedic surgeon, but I want to be a plastic surgeon now. And this is what I decided I wanted to do. It was so inspirational to me that I knew that I wanted to do that. So my first question was, okay, my grades are good, but I want to look better when it comes time to applying for residency programs, which are obviously the next step after medical school. And so I did I was blessed, and I have, very, very supportive family members. So I actually took a sabbatical after my third year of medical school, which is not the most common thing to do. I took a year off, and I moved to New York City, and I entered the microsurgery labs at Bellevue Hospital at NYU. And Doctors Armin Kasabian and Doctors Armin Kasabian and Nolan Karp were my microsurgery lab directors, and I spent a year doing microsurgery research. I would operate on little tiny rats, and I would test cell death after free flaps. Now, free flaps are these kinds of tissues that if you were to get a really bad injury somewhere and lose a part of your tissue, whether through trauma, burns, or cancer removal, a free flap is actually a tissue transfer where you take healthy tissue from somewhere with its blood supply, take it to the part that needs to be fixed, and plug in the blood supply. So it involves microscopic sutures. You use microscopes to do all the little tiny work, and it's very, 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 very meticulous work. And so I was doing bench research in that field, and it was great. I published 2 papers. I gave international and domestic talks on my research. It was fantastic. So I took this experience, and when it came time to go back to medical school, I was ready in my 4th year medical school to go ahead and interview at the top plastic surgery programs around the country. And I actually matched, and I started my plastic surgery journey at Emory University in Atlanta. And at that point in time, Emory was probably the #1 program in the country. But I was a very unusual resident. I was what you call a prelim. I was not a categorical. So I was the first resident to go through a hybrid concept known as a 3-in-3 residency, where you would do 3 years of general surgery, which is the minimum that the RRC required for you to become a plastic surgery resident, and then you would do 3 years of plastic surgery. So I did 3 grueling years at Emory Hospital, Crawford Long, and Grady Memorial Hospital, a level 1 trauma center that saw the worst of the worst of medical problems in Atlanta. And so I got through to my 3rd year, and at that point, things changed. I was married, and my first child was on the way, and I had to change pathways at that point. So I left Emory, and it was a very, very stressful time, because I had started a life that now had to be rerouted. And I luckily, I got a PGY4 categorical spot at the Medical College of Georgia in Augusta, where they play the Masters. So I finished my last years of surgery residency, and I was a chief resident. I did my trauma work, and I was ready to operate as a surgeon. At that point, I applied for plastic surgery residencies for a 2nd round, and I actually got the best position I could have ever hoped for. It was this fantastic program in Chattanooga, Tennessee, at Erlanger Hospital. It was a very unusual program because it was a hybrid between an 8-man, or 8-person, I should say, 8-person private practice with full academic capabilities. We had a level 1 trauma center, we had 2 helicopter systems, and we would get patients of all kinds from 7 states. So the amount of clinical material I got exposed to made me, when I was done, the 99th percentile in facial surgery and the 99th percentile in hand surgery in the country for residents. So we were so exposed to, sorry about that, so we were able to really be ready when it came time to sit down for our boards in Phoenix and become board certified. So I went through the board certification process, I collected all my cases, and I passed the test with flying colors and became a board certified plastic surgeon. I had moved out to Denver by this time, and at that point I took over as the chief of plastic surgery at a level 1 hospital known as Denver Health, which is our most significant trauma center in the Denver region. And so I got plenty of great cases out of that, and I ended up being a plastic surgeon. I went off into private practice, and I had a hybrid model of academics with private. And then I finally went into solo practice about 2.5 years ago, and I've been loving it ever since. So yeah, it's a long road. It's a lot of work. You know, I'm an entrepreneur. I have, we run a very, I have this beautiful little boutique practice. We run a very tight ship, and you know, we try to deliver the best care we can, 1 person at a time, until we get it, you know, until it's just perfect. You know, that's just how we do things.
Well, feedback is your patients love your bedside manner and how they feel very focused attention from you each and every time they see you, which is
that's how it should be. I mean, you know, we're here in the caring business. You know, I think it's important that your doctor can, you know, that they can educate you and that they, you know, can give you all the tools you need as a patient to make good decisions for yourself. Because in the end, you have to live with these decisions as a patient. Like, I can do what I can do, and I can do it the best I can, but in the end, you have to live with it. So if I'm not giving you good information and you're not making decisions that are good for yourself, no one's winning in that process.
Yes, exactly.
Yeah. So that's how you become a plastic surgeon, you know?
So my question is, how does your dad feel about the fact that you weren't going to be an orthopedic surgeon?
You know, initially he was a little bummed out about it, and I get it, because he wanted to leave a legacy, because he'd done a really good job and had really built something, and he had tried junior partners here and there, but you know, none of them had the love for what he had built that he figured his son would have had it. So he's a little disappointed, but he's perfectly happy that I became a plastic surgeon.
Good.
Yeah, but it took a little while.
Well, is it time for our
I think it is.
real self question of the day? Let's see. Okay, so I have a bunch of girlfriends. We always talk about different sorts of things to stay looking younger and you know, vibrant as we age. But this one is in particular is from a real self question. She says, "Hey, so a Brazilian butt lift is not really possible for me as I'm not carrying too much fat. I've heard about the non-surgical stuff like Sculptra and whatnot. Sounds a bit impossible and magical. Is it bullshit? If it really works, are the results outstanding or rather small to the eye? Aren't there any butt fillers like for the lips?" So like kind of on a bigger...
Yeah, sure. So let's talk about this. So one of the things that I do here in town, besides rhinoplasty, is I do a lot of buttocks augmentation. And we do everything. We do fat transfers, we do implants, we do hybrid work, and then we do non-surgical, not very often, but we do have some non-surgical patients who use Sculptra. So when you're a patient who has some fat, you can always get a great liposuction and put the fat in. The reality is the fat that you harvest, even if it's the best quality fat, you're going to lose 30 to 40% of it. So you never really get the big outcomes that you see on all these, you know, surgeons' Instagram accounts where they show you the person standing up and they show you the person flat on their stomach with the bed bent. I mean, it's a light trickery thing, and you should, as a consumer, never believe it. I mean, you want to see, you know, compare apples to apples. So you want to have a standing patient before and a standing patient after. You want the, you know, comparative angles, you know, front, side, 3/4 view, that sort of thing. So if you're not seeing pictures like that, just be a little wary about what they're getting. But if you see really good before and afters for them, at least 6 months out, then you know that they're getting good results. So when you don't have a lot of fat, you can still do the liposuction, get a cuter midsection, get cuter inner thighs, you know, cuter outer thighs, just get a little bit more body contour and put the fat that you can put in there. But in those cases, a lot of times we have to do the fat if we can do it, but we always put implants in.
Okay.
Now, if you're not an implant candidate, or you don't want to put the implants in because you're afraid of implants, because I have to tell you, there's quite a campaign out there against butt implants. Now, I love butt implants, and they do really, really well. We've had simply no complications with them. But you have to have a surgeon who knows what they're doing so they can give you a good buttocks augmentation. The problem is the buttocks is a very large area. So in Europe, there's a product known as Macrolane. Macrolane is it's a hyaluronic acid, very similar to Restylane or Juviter, but it's in large volume. So you can do a non-surgical buttocks augmentation, and you'll get a year out of your Macrolane, maybe a year and a half, and then it's gone. So you would have to repeat, you'd have to repeat the injections. You'd have to fill and decompress, and fill and decompress. And my only concern is with that is over time you might create lots of stretching, lots of laxity of the skin, and problems that you didn't consider. You know, you want to try and do something in the buttocks that's going to last. Sorry about that. We ran out of battery in the first camera, so I just put my cell phone on so we can finish this up. So I had just started talking about Sculptra. The basis for that is that, you know, you don't want to expand and empty, expand and empty. That causes loose skin. There's nothing worse than a saggy backside. You know, that's the worst thing. Then you have to get buttocks lifting and other things like that. So I don't recommend actually the short-term fillers because one, you have to use a tremendous amount of it and it's very expensive. But that same argument about expense goes with Sculptra. So if you watch some of these folks on social media doing these 40 syringes of dilute Sculptra, that is $40,000 of Sculptra. I mean,
that's crazy.
So if I'm going to do it, I do one dilute Sculptra at a time and we slowly build up from it. But a lot of times you can get enough shaping with fat and actually get a really nice result, even in thin patients. So on my Instagram channel, I do have a before and after of a young lady I did who was in her 40s, but she wasn't very big. And you can do BBL or Brazilian butt lifting when you don't have as much fat as you think. But doing things like gaining weight to have fat stores doesn't make any sense, because whatever your lifestyle is that gets you to the body that you have when you come in to see your surgeon, that's the lifestyle you're going to go back to. I mean, so don't think that you're expanding the number of fat cells. Fat cells stop dividing after the age of 13. So up until 13, you'll be making more fat cells based on diet, exercise, genetics, hormones, that sort of thing. But after 13, your fat cells are now in storage form. They either get bigger or smaller based on how much you eat and don't exercise, or how much you do, how much you do exercise and take care of yourself. So when you take those fat cells out, they have the potential to grow or shrink in the new location you put them into. So maybe if you do gain some weight, let's say you're thin and you do take fat cells off and you put them in the buttocks, maybe if you gain a little bit of weight, your butt will actually get a little bit bigger, but you'll gain weight in other places as well. So think about that before you go down that pathway. That's why sometimes implants are great. They are the size that they are. They stay that way for the rest of your life. Mm-hmm. Now, these are solid silicone implants. In the old days, they would put breast implants into a person's butt. Now, that's ridiculous, but that's all they had. Now we've got great companies that engineer these beautiful, solid, surgical-grade silicone implants. They're strong. It looks like you're a squat queen. I mean, it really, really makes you look very, very athletic. So when we do operations where we just put butt implants in, those patients have one particular athletic look. When we do BBLs, those women tend to have more of the Coke bottle, flouncy, sultry look. When you do implants and fat, it's more of a hybrid look between the two. So it really depends on how you see yourself. In my practice, it's mostly Caucasian females that are really thin that are getting butt implants. It's my women of color, my African American patients, my Latina patients. They already love curves. Curves are a big deal in their cultures. So more curves are better. So for them, BBLs are like the number one thing to go. Now they've got thin patients in both those, in all those cultures. And they've got rounder, more curvy women who are white as well. So that's not the gospel, but that's basically the average is how things go in my practice in terms of who gets what. But you can use fillers, but I would not recommend the hyaluronic acid fillers. That's just a waste. If you're going to do something like Sculptra, do it hyperdilute, do it over a course of time, because it's an easy thing to do in the office. It really is. I mean, it's just, you put some numbing medication on the buttock for 30 minutes, and then you just make multiple little punctures and do little fills, and then they just massage it in. And that's a good thing about Sculptra. You actually want to rub on it. You want to massage it. You can sit on it. You can't do those things with fat cells, and you certainly don't want to do a lot of stuff in terms of moving when you have implants in. So it's a nice option, but I would not recommend hyaluronic acid. So to the lady on Real Self, Sculptra, yes. Hyaluronic acid, no.
So I know that I've heard a couple questions like, can you use fat from someone else if you don't have your own fat?
So no, you can't. But I'm going to say that with a caveat. Our fat, so if you were to take your sister's fat or your girlfriend's fat or your mother's fat, there are immune cells in there that will cause immediate rejection phenomena, which will definitely kill all the fat, but the immune reaction could go farther beyond what the surgical site and create systemic problems in the person who is getting the fat. And so you don't want to do that. Now, that being said, there are companies out there that are slowly coming out with these acellular, cadaver-based fat fillers. Now, they come in small volumes of 1.5 to 3 cc's, and they are exceedingly expensive. They cost more than a syringe of Sculptra. So you can use them for maybe filling in small divots or hail damage, as we call it, on the buttocks. I mean, you can definitely do that, but at this point in time, we don't have enough volumetric. If you need a large BBL, you got to either have the fat or you're stuck. You don't get to have that kind of procedure.
Okay, well, I think you answered our question.
Good. All right. So thank you for, I guess this is the end of our very first episode. Sorry about the technical difficulties. With time, we'll have this smoothed out. But thank you for visiting. My goal here is to make sure that we really bring some high quality, no nonsense, no frills information about cosmetic surgery, general health, things that are going to make you get a better life, feel better about your life, get healthier, and just live the best life that you possibly can. So what I'd love for you to do is, if you've got comments, please comment down below. Please like this video if you like it, and I would love it if you would share it with other people who are interested in the topics that we come up with. And finally, if you have any ideas about topics you want us to discuss in the future, please put them in. I'd love to. Yeah, we'll definitely. We'll talk about anything. So I spend my whole day talking, 5 days a week, and so I love to educate, and you'll find that pretty evident if you spend enough time around me. So thank you for watching our inaugural cosmetic surgery and coffee episode number 1, how to become a plastic surgeon. And until next time, it's Dr. Shah and Misty.
Bye-bye.
Bye, guys. Thank you.